Hello and welcome back to my channel. Today I'm going to talk about vaginismus. Vaginismus is a condition involving a muscle spasm in the pelvic floor muscles. This makes it painful, difficult to have intercourse, to undergo a gynecological exam, and to insert a tampon. The vagina tightens up because of an involuntary contraction of the pelvic floor muscles, leading to a generalized muscular spasm, pain, and temporary breathlessness. Eventually, it can become so bad that the woman starts to feel a contraction of the vaginal muscles even when touched near the vaginal area. The most commonly affected muscle group is the pubococcygeus muscle group. Now, these are also called the PC muscles in the pelvic floor region. These muscles are also involved in urination, bowel movements, intercourse, orgasm, and childbirth. So these are situations in which these muscles are actually expected to contract fully. So remember that pelvic floor muscles are never fully relaxed. Vaginismus does not interfere with sexual arousal, but it can prevent penetration. A physical examination of the area will typically reveal no abnormalities causing the contractions. Vaginismus may be associated with additional symptoms such as fear of penetration and also decreased sexual desire related to penetration. Women with vaginismus will typically report burning or stinging sensations whenever anything is inserted into their vagina. It is important to note that in vaginismus, the vaginal muscles tighten up despite the woman's desire to have sexual intercourse. If you have vaginismus, it does not mean that you will stop enjoying sexual activities altogether. In fact, women with the condition often crave and feel sexual pleasure and can have orgasms through modes other than penetration. For a clinical diagnosis, all of the symptoms that I've described must be present at least 50% of the time during intercourse. When it comes to the prevalence, although the population prevalence of vaginismus is unknown, the prevalence rates in clinical settings have been reported to range between 5 to 17% of women globally. Now, this wide range in prevalence rates most likely has a socio-cultural cause, since the highest recorded cases come from conservative countries where women's rights and freedoms are often curtailed. When we describe the types of vaginismus, it is divided into two headings. Under the first heading come primary and secondary vaginismus. Now, primary vaginismus is a lifelong condition where the involuntary contraction of the vaginal muscles has always been present. However, the woman first discovers this at her first attempt at sexual intercourse. The male partner is unable to gain entry into the vagina and often describes a sensation of hitting a wall at the vaginal opening. The symptoms are reversed completely the moment the male partner withdraws his penis. Secondary vaginismus is described when vaginismus occurs after the woman has already experienced normal sexual functioning. It can occur at any stage of life and may not have happened before. Usually, secondary vaginismus comes after a specific event, such as an infection, menopause, traumatic event, development of a medical condition, childbirth, surgery, or relationship issues. Now, even after the underlying causes are corrected, pain can continue to happen if the body becomes conditioned to responding in this way. Under the second heading, you have global vaginismus, where vaginismus is always present and in all situations, and situational vaginismus, where vaginismus occurs only in certain situations or with certain partners. Now, irrespective of whatever type of vaginismus, remember that vaginismus varies in its severity with different women. For example, some women are completely unable to insert anything into their vagina. Other women may be able to insert a tampon and even undergo a complete gynecological examination but are unable to have sexual intercourse. Some women are able to have sexual intercourse but have extreme pain during the penetrative process. Some women are able to have intercourse but are not able to orgasm because of the extreme pain associated with the sexual intercourse. And some women may have occasional difficulty during sex throughout their lives or for several years and have to constantly be ready to relax and contract their vaginal muscles when the symptoms come. Okay, that's it for today. Thank you for watching this video till the end. Stay tuned for the next video where I'm going to describe the causes of vaginismus. Have a great day ahead.